All right, hello everyone. Welcome to Spine Time. My name is Joshua Weaver. I am a neurologist and one of the co-directors of the Spine Center at Weill Cornell. Today I'm your host and moderator for our Spine Time webinar. It's my great pleasure today with my co-directors and the staff here at the Spine Center to welcome you to the latest installment of our Spine Time webinar. Today we're covering a very important topic. Is your weight hurting? It's actually Oops. Okay, sorry. It actually is a very interesting question because we're not always clear when your weight does hurt your back. I think there's a clear link between obesity and back pain, but it's a much more complicated situation. Not everyone who is obese or is overweight has back pain, and there are many people who are not overweight who have back pain. I think genetics are a big part of it. Our diet and our nutrition are a big part of it. Our core strengthening, core muscles, and our posture play a big role in this. So I'm really interested to delve into this topic a little bit, and I think it's an important one that a lot of people face. So I just wanted to thank the speakers today and our co-directors and the staff. I also really want to thank Roseanne and the team at the neurosurgery group at Cornell for putting these webinars together. It's a lot of work and we really appreciate it. As many of you know, the Spine Center is at 59th and 2nd Avenue. It's the Weill Cornell Medicine Center for Comprehensive Spine Care. We have over 20 physicians on staff, and we have physiatry, sports medicine, pain management, neurology, like me, neurosurgery, but we also work with a lot of other medical disciplines. We work with complementary medicine practitioners, psychologists, and a lot of other internists and integrative medicine professionals. Before we start with our speakers, I just wanted to say a few words about the webinar. Many of you have submitted some really great questions. We will try to get as many of them as we can. We might not be able to get to all of them, but there is a website, spinewebinar.org, and you are able to submit questions via that website. These webinars are being recorded, so we wanted to remind you to turn your videos off because these will be available for viewing online on YouTube. During the course of the webinar, there is a chat function, and we highly encourage everyone to use the chat function if there are any questions. I'm going to be looking through the chat as we go through, and I'll be presenting questions to the various speakers so we can discuss those. So please do interact with us in that way. We will have about 45 minutes for the whole webinar. So just wanted to introduce our speakers. So very proud to introduce these two. We have two great speakers today. On the left, we have Dr. Rekha Kumar, and she is board certified in internal medicine, endocrinology, and obesity medicine. She's the triple threat here. She works at our Comprehensive Weight Control Center at Cornell. We actually go way back. We were interns together. I'm not going to say how long, but we go way back. So I'm really happy to see her again. And on our right, we have Dr. Zachary Mulvihill, who is currently a fellow at our Integrative Medicine, in Integrative Medicine at our Integrative Health and Wellbeing program at Cornell. He has a particular interest in mind-body therapies as well as Ayurvedic medicine, which he's going to talk about a little bit, and I'm really looking forward to hearing that. So I guess without anything else, I just wanted to get started. Why don't we start with you, Dr. Kumar, and I know you have some slides prepared. Maybe tell us a little bit about yourself and your experiences at the Weight Loss Center.
Sure. So thank you so much for having me. It's great to be here. I'm a general endocrinologist with a focus on obesity medicine, which is actually its own field of medicine now, and it's growing very fast. There are fellowships, people are getting board certified, and so if someone struggles with their weight, they really can seek out a specialist to help them and take a medical perspective on all of this. So to get started, we're going to talk about defining and measuring obesity, and this is really important because I think kind of what people always look at now are body mass index charts, and they might not always be accurate for everybody. So defining and measuring obesity is complicated. The definition of obesity is actually an increase in body fat that impairs health. And most accurate ways to measure body fat would actually be things that are quite complicated, such as submerging someone in water and measuring water displacement, or this thing you see on the right, which is air plethysmography. It measures air displacement, or a DEXA scan, which you see in the middle here. These are ways that we could get relatively accurate measurements of body fat, but these are things that are time consuming. We can't do this in the office. They're not covered by insurance. So we use methods more on the left, like, using different types of calipers or body bioelectrical impedance scales that can measure, differentiate between lean mass, fat mass. But in clinical practice, what we have in the office is BMI, or body mass index, which is just an equation of weight in kilograms over height in meters squared. So it's really just an equation. And I know that people out there have seen these charts, and people will show up with a high number and say, this health fair told me that I have obesity. Is this true? And it's not always true. There are people that have high BMIs that can be metabolically healthy, and there's people that have lower BMIs that can be unhealthy. And things that affect this are fat mass, body composition, genetics. So I would look beyond just body mass index when we are talking about who is carrying extra fat or has obesity. We can go to the next slide. So another way, since measuring obesity and fat mass is complicated in practical terms, another way to look at this is by staging obesity the way we do other medical conditions. So if somebody has a high body mass index, are there any complications of that? And we actually could stage somebody's obesity by looking at medical, mental, and functional comorbidities. So somebody that has a body mass index of 32, so that falls into class 1 obesity, that has no medical, mental, or functional comorbidities would be considered class 1 stage 0. And just to let you know, Arnold Schwarzenegger at his peak bodybuilding health had a body mass index of 32. So obviously he didn't actually have obesity, but he had a high BMI. So then progressing into stage 1 would be some mild preclinical complications, such as prediabetes, prehypertension, maybe some mild psychological distress about one's weight, and maybe some mild functional impairments, maybe some joint pain. Then we could progress to stage 2, where we see real comorbidities of obesity, such as diabetes, hypertension, legitimate arthritis, back pain. And then stage 3, we start, like other diseases, we see end organ damage. You could talk about kidney damage from diabetes, diabetic neuropathy. We can see, the requirement for joint replacements. In the mental category, depression complicating someone's weight. And then stage 4 obesity would be, end stage disease, the way we have in other fields of medicine, where people are, from a functional perspective, wheelchair bound, potentially have congestive heart failure, and are requiring dialysis due to complications of obesity and diabetes. So how does obesity actually cause disease? So this is relatively new information, I would say, in the past 15 to 20 years, that the fat cell does more than just store fat. It's actually a multi-endocrine organ capable of releasing several mediators of inflammation. And what these mediators of inflammation do is that they can predispose people to certain disease states. So if you look at in the center here, if that's the fat cell, things that are released by the fat cell include an increase in angiotensinogen, leading to an increased risk of hypertension, an increase in free fatty acids, leading to dyslipidemia and type 2 diabetes. Fat stores lead to an increase in the hormone resistin, plasminogen activator 1, and estrogen. And all three of those could increase blood clot risk or thrombosis. When there's increased fat stores, you have a decrease in adiponectin, which can actually increase your risk of diabetes and atherosclerotic cardiovascular disease. And then on the left, several mediators of inflammation: complement, TNF-alpha, leptin, IL-6. These are all general mediators of inflammation that can increase the risk of cancer, arthritis, and type 2 diabetes. So how do we actually regulate our weight? So as I told you, the fat cell is much more complicated than we ever thought, as is body weight regulation. We always thought that calories in, calories out, and that's how you control your weight. but anyone that's ever tried to lose weight knows it's much more complicated. This is just a schematic of the brain and specifically the hypothalamus, which is showing two bodies of neurons that are actually our weight thermostats. This is our weight regulating center in the brain. And just the way we regulate temperature and other things, we actually have a set point for what a healthy weight is. And the way this is determined is by all these signals coming in from the periphery. So you hear in this picture, you see the liver, you see the stomach, you see the fat cell, and there's all these hormones and neurohormones coming in, signaling to the brain whether a person is full or fasted or whether there's adequate fat stored. And there can be dysregulation at all of these levels here, making it difficult for someone to control their body weight. So why don't people just lose weight? So this kind of relates to my slide that we just passed, that after weight loss, levels of satiety and hunger hormones are altered in a way to increase hunger and reduce satiety, favoring weight regain. So everything that's supposed to help you feel full goes down, and things that make you hungry go up when you've lost weight, promoting weight regain. So the things that we can offer to somebody that's struggling with their weight, we offer everyone behavioral intervention. That's still the cornerstone of weight management. So calorie reduced diet plus exercise. In people that have a higher BMI plus higher risk, we introduce medicine for weight loss or anti-obesity pharmacotherapy, which is FDA approved. And for our highest risk patients, there are surgical interventions that we offer them. So in terms of our dietary interventions, they vary across the board. It depends on what works for somebody. We recommend low carb diets. We recommend focusing on unprocessed food versus ultra processed food. We recommend focusing on food order, eating vegetables and protein before carbs to stabilize blood sugar and weight regulating hormones. We also encourage people to track, keep food diaries, log their intake. That actually shows that people have better long-term success. We encourage intermittent fasting for those that it works for, and there's different ways of doing it. Some people restrict calories 2 days a week. Some people do time-restricted eating where they consume all their food in a certain window. And we do support the use of meal replacements with shakes, bars, prepackaged meals that might eliminate some of the decision fatigue for people that are struggling with this. Olive oil over butter, Mediterranean diet type focus we encourage as well. So this is just a study I wanted to show you guys a picture of. On the right, you have an unprocessed diet. And on the left, you actually have a meal that's the exact same calories, exact carbs, exact protein. So the essential, like all the components of the meal are exactly the same. But look how much more food there is on the right when you have whole foods that are unprocessed versus on the left where you basically, you know, you can see why somebody could eat beyond their caloric needs when energy is so, you know, packed into things.
This looks so delicious on the right, and I would eat like 5 times the amount of this on the left, so I definitely get it. That's really, it's important.
So this is just looking at the results of basically what happened where people were fed the unprocessed diet or the processed diet, and then they were allowed to have access to food in between, and then the groups were switched. And what happened when people were eating the ultra processed diet is that they actually ate more between meals. So there was like the weight regulating, appetite regulating system was not working when people were consuming this ultra processed diet, and body weight, fat mass went up. All mass went up. So what type of diet is the best? The answer is that it's basically the diet that the patient likes best. So this is an actual study published in JAMA that compared the Atkins diet, the Zone diet, Weight Watchers, and the Ornish diet. And if you look at weight loss between the 4 diets, it's not that different. But if you look at the data another way, according to dietary adherence score on the right, basically people that stuck with any diet lost weight. So we basically have to really work with our patients to see what works for them and what they're likely to adhere to.
Got it. So that was really great. Thank you so much, Rekha. I mean, it's obviously a really complicated issue. And like you mentioned, we're still learning so much more about the role of fat cells and what they do. And it's so annoying to me that when you lose weight, your body's natural instinct is to like kick it back up, you know?
It's
didn't do that.
pretty upsetting.
Yeah, it's really annoying. But it's so interesting to see, you know, how the adherence to the diet actually matters more than the diet itself. I think that's such a fascinating thing. So, you know, because people ask me all the time, what is the best diet? And I guess for various reasons, you may pick one over the other, you know, for a specific patient, but it's really a case by case thing. You know, there's
Totally.
not a one size fits all here. So that's
Yeah.
great. Thank you. We have a couple of really good questions actually just from Linda so far. So I'm hoping that some other people will also come in, and we're going to get to your questions, Linda, as well. Let's move on to Dr. Mulvihill here. And thank you, Dr. Kumar, for that. And if we can just go into, and I'll advance the slides, but you know, the Integrative Health and Wellbeing Program.
Thank you, Dr. Weaver, and thank you, Dr. Kumar. And thank you, everyone, for being here. So call me Zach. So I'm one of the doctors at the Integrative Health and Wellbeing Program. Next slide. So what's the objective of the Integrative Health and Wellbeing Program? So what we look to do is to really individualize healthcare by taking kind of the best of both worlds. So the best of conventional medical treatments and bring them together with evidence-based integrative medical treatments to promote wellness, so physical, psychological, and spiritual well-being. So you'll see from this broad list below, we draw from a wide variety of modalities to try to achieve that goal. So what makes our approach integrative? So for starters, we believe in longer visit times. So for a couple of reasons. One is it gives us a good chance to really get to know you as a patient and as a person, but also to take a deep history, to really get at the root cause of the disease and not just address the symptoms. We also want to focus on a personalized treatment plan. So meet you where you're at and work on things over time together. Something like Dr. Kumar was talking about, things that work for you in your life that you're going to do over time will have much more benefit than if it doesn't fit. We use a team-based approach, so I'll talk about this in later slides. We have many different providers in our office that we can work together in a team, including acupuncture, nutrition. So I'll mention those later. Continuity of care. So this can be just in terms of, you know, in-person office visits, telemedicine. But for example, I will send all my new patients a really detailed email listing out my recommendations if I want them to read different resources, because it's really a partnership between the patient and myself. And if I'm recommending supplements, I'll give you the links, those types of things directly, so you don't have to research things on your own. And lastly, evidence-based practice. So we're always trying to bring in the latest research, latest technology into what we're doing, and we'll meet frequently to try to keep everyone up to date. So this is our team. Dr. Chidi Parikh is our executive director. You see myself, Dr. Cohen, Dr. Parikh, and Dr. Abdullah. We all see adults. We also newly have an integrative pediatrician, Dr. Loy. She tends to focus on patients between the ages of 10 to 25 years old. Janet is our nutritionist, Nisha is our clinical psychologist, and Emily is our mind-body instructor. We also have 3 wonderful acupuncturists, Oleg, Yvette, and Irina. So these are our services. So you'll see everything's covered through insurance besides massage at this point, and even that we're working on. And if people have questions about this, I can answer them later on, because basically coverage has been pretty excellent for people to see all these different types of providers through their insurance.
Great.
We also offer a lot of group classes, so shared medical appointments. These generally tend to focus on nutrition and mindfulness, and they're paired with an MD. But we also have other offerings, like there's a 1-day mindfulness retreat, a Reiki retreat, and we also have an 8-week really intensive mindfulness-based stress reduction course, which has really great reviews, but obviously it's a larger time commitment. We also are offering group acupuncture. Currently, these are in private rooms. It's not actually in a group, and I can answer questions about that later. So let me talk a little bit about the Ayurvedic perspective on weight loss. This isn't the only approach that we use to weight loss in our office, but it is the one that I prefer to use. And I think you'll find it interesting. I don't think you'll have heard much of this before. So Ayurveda is the science of life and the art of living. And in Ayurveda, it's food is medicine. So it comes from ancient India. It's similar to Chinese medicine. It's one of the, it is the oldest complete medical system on the planet. So before you can really understand Ayurveda, and we're not going to be able to really cover all this, but to try to bring it down to the simplest form, you have to understand your constitution. So every person has a unique constitution. These are a combination of the three doshas, they call them, Vata, Pitta, and Kapha. So each of them, you can think of it from a Chinese medicine perspective. They start from the elements and they combine in certain ways. So you can think of the doshas as a biological principle, and I'll try to bring that to life a bit. So Vata is a combination of ether and air. It governs movement and circulation throughout the body. Pitta is a combination of water and fire. It governs digestion and metabolism. It also governs cellular metabolism. Kapha is a combination of water and earth. It governs structure and solidity in the body, and it's the anabolic building up principle. So each of us will have a certain mix of these based upon what our parents, what their mix was at the time of conception. That'll give you your constitution. That'll be unique to you. It'll be a certain mix of them. It doesn't generally change over time. What does change over time is your Vikriti, which is where you're at now. So the whole idea is to try to bring you back into balance. So someone who has a lot of Vata in their constitution, they say it looks like Sarah Jessica Parker. So they have long, skinny fingers, brittle nails, dry skin. They tend to be chronically underweight. Digestion can be on the fickle side. They tend to have darker features, darker hair, small, dark eyes, and they tend more towards anxiety. Granted, broad strokes here for everything. Pitta, they say Steve Jobs was an example of someone who's very Pitta. So Pitta have a lot of fire in their nature. They make really good leaders. Pitta also governs the sense of eyesight, so they'll generally have good eyesight. So their strong digestion can be to the point where they have so much fire in the body, they have GERD, inflammatory bowel disease. These all are very like Pitta conditions. Tend to be more of a medium build. They can have red hair, red beard, flush skin. Kapha is slow and steady. So people with a Kapha nature generally have a slower metabolism to begin with. They have a proclivity to hang on to excess weight, excess water, and maybe excess emotions in some sense. Kapha also has a very oily quality. So they tend to have oily hair, oily skin, large joints, large eyes, and noble features. And it tends to be easier for them to keep a routine compared to someone like Vata, who's inherently like the wind, a bit more chaotic. So that's just a general overview of kind of the three doshas and how they might come into your individual constitution. So Ayurveda has a lot to say about daily routine and meal timing. So I'll go to the next slide for this, but I'll just say briefly on this slide that in general, they try to aim for breakfast around 7 a.m. being on the light to medium side, lunch being the largest meal of the day around noon, and dinner being the smallest meal of the day around 6 p.m. So I'll show you my next slide. So this slide's busy, so just to break it down, this is just to show you that each dosha is active at 2 points in the day. So you'll see from 6 a.m. to 10 a.m. Kapha period. Again, from 6 p.m. to 10 p.m., Kapha comes back and is predominant. Pitta is primarily active from 10 a.m. to 2 p.m. and from 10 p.m. to 2 a.m. Vata is active from 2 p.m. to 6 p.m. and from 2 a.m. to 6 a.m. So the way that the Ayurveda, like a typical Ayurvedic routine, so if you imagine you were in a village before there was civilization, right? You would wake up when the sun came up, go to bed when the sun came down. So your schedule would be shifted much earlier than it generally is now. So they would wake up at sunrise or a bit before sunrise. So you're coming out of that Vata phase into a Kapha period. Kapha generally tends to be a good time to do a self-care routine. So what they would do is they would wake up, brush their teeth, wash their face, and do like some self-care, like a self-massage with oil, some light yoga, shower, and then they would sit for breakfast. Breakfast would generally be like a small to medium size, and it'd be a warming food to try to bring some heat into the body. Then you'd go about your day, and then you would have your largest meal of the day around noon. The same way that the sun is overhead in the sky, your digestive fire is at its peak in the middle of the day. So your metabolism can really handle a larger meal at that point and will be better able to digest and assimilate the nutrients from that meal. So then after that, you go into a Vata phase, and then between the Vata into Kapha is when people are starting to settle down, okay? And that's when they want to do a light dinner. This is generally where we get into trouble in America, is that we eat too much too late. So the typical pattern that I usually see is that we have a big dinner, And then when we wake up the next morning, we don't feel hungry. In Ayurveda, actually, they use the tongue for diagnosis. So they look at the tongue, there'd be a thick white coat, which usually says maybe there's undigested or less like toxins sitting in the colon. But regardless, people wouldn't be as hungry in the morning. So then you get up and go, you go to work. You don't have as much time to really nourish yourself during the day because you're coming to and fro. So don't get the proper nutrition when you should be getting it. And then the cycle repeats itself because you get home, you're super hungry, and you have too large of a dinner, and that tends to go on and on. So I'll go to my last slide. This is just to reiterate what I was talking about. There's much more nuance to all these things, just broad strokes. In general, it's good to try to get up early as possible, close to sunrise. Do some nice self-care, a ritual, then sit for a light breakfast that's warming. Put your largest meal of the day between 10 to 2 p.m., closest to 12 noon if is possible. And then for your dinner, you really want to have it between 5 to 7 p.m. or so, and it needs to be on the lighter side. Try to get bed before 10 p.m. because that's when pitta is peaking again. I think most of us notice if you stay up too late around midnight, you get the munchies, you notice a fire in your belly. That's actually the pitta peaking. That pitta is there to help metabolize the toxins from the day, everything that's left over. And also there's emotions, things like digest, all that, go into your deep sleep. So that's a general Ayurvedic routine. So I'll go back 2 slides just to finish up, just 2 more brief comments. So we talked about your constitution. We talked about meal timing. Again, no one's perfect. I don't keep to this all the time myself, but in general, if you pay attention to it, you might notice some differences. But not only what we eat and when we eat, but how we eat it is important. So in Ayurveda, eating is a form of meditation. So it's important not to have the TV on, not to be on the phone, not having a political conversation. Just sit with your food and really be grateful for it, be mindful, and chew your food thoroughly. So we really don't do this enough. So they say to actually take a forkful and then chew your food 30 times. That'll break the food down into smaller particles that'll be easier to digest. It also will slow you down. It'll give the stomach that like 20 minutes or so to communicate up to the brain to say, hey, I'm actually full already. No distractions we talked about. The 50-25-25 rule is to say that the stomach at the end of a meal should be 50% food, 25% water, and 25% air. So 25% water means that you're sipping hot water with your meals between bites. So that's generally what they recommend, is to just sips of hot water. And then the other 25 air means don't overeat. In general, we tend to overeat, and that overloads the stomach, doesn't really give it the space it needs to properly digest our food. Lastly, I'll just make a brief comment about eating seasonally. There's a whole big thing in Ayurveda to follow the seasons and how it can help heal different diseases. So in summer, pitta is very predominant. So it's a lot of heat, excess heat in the body. So pitta conditions tend to be exacerbated. In general, in the summer, we can handle more raw foods, and we want to eat a more cooling diet. As we come into fall, however, which we just have, we notice this cool, dry quality comes in. So it's important to bundle up, stay warm. And in general, we want to cook our foods more. Our digestion is more of the vata type, like I talked about. It's a weaker digestion. So we need to cook our foods more, soups and stews, bring warmth into the body. Also, the cool, dry quality, right? To counteract that, we want to bring more oils into the diet. So organic sesame seed oil, not for everyone, but in general, incorporating a little bit of more healthy oils into the diet, and also in your self-care routine, getting oil into the body through the skin. So I think I'll leave it at that.
All right, that is excellent. Thank you, Zach. I really appreciate that. I love that, a lot of this, yes, we're talking about weight, but there's so much more just about, whole health, just more of a holistic view on how to be healthier. And it's really not all about weight. It's a big part, but it's not everything. And I love that we have our Western science view, but we also have thousands of years of really rich cultural traditions in other parts of the world that we're now starting to integrate in with the science. And I think that's such a wonderful thing that we're really bringing together here. I find that whole Ayurvedic medicine so fascinating, and I think there's so much to offer there. So I'm really glad that you've enlightened us a little bit with that. So we have about 15 minutes, and I just wanted to open this up to questions. We have a number of questions that have come up in the chat, so I just want to start bringing these out with you guys. So we'll just start at the beginning, but we'll work our way through. There was a question about why women tend to gain weight in stomach and hips, and why men may gain weight in different areas. Is there, maybe Dr. Kumar, you can tell us a little bit about, is there any gender differences between weight gain, and do you approach genders differently in terms of your approach for weight loss?
Yeah, so definitely I would say that men and premenopausal women store fat differently. But the postmenopausal female does, due to the decline in estrogen and a change in several other hormones, postmenopausal female tends to store fat around the belly and similar to a male. I wouldn't say we approach weight management totally differently unless there's a specific issue related to a hormonal change. So perimenopausal weight gain or something related to reproductive health. But I would say men and women do store fat in different areas depending on stage of life. And if it's relevant to what we're doing, then we do address it.
Excellent. We also had a lot of questions about sort of the Ayurvedic approach. Some people had some questions, what if you're a night owl, or what if you're, an early morning riser, do you always have to fit into that mode? Some people feel like, what I think Carol mentioned here, that her Ayurveda is turned on its head. So some people don't seem to fit into that mode. What do you tell people about that who don't seem to fit very well into that model?
Yeah, definitely. So I just want to say that in general, I'm trying to condense a lot of this stuff and just make it simple. It really is something you need to have a one-on-one consultation for and really to get into it, to adapt it to your life. But it is good to have that general framework, because if you pay attention to these things, you can find that they're true in general. Like, for example, if we don't wake up by 7 a.m., usually it's a little bit harder to get out of bed unless you get past that time, because that's a kapha period. It brings that heaviness in. I think most of us realize that eating the largest meal during lunch probably makes sense, because we do feel that big digestion. And I think that sometimes gets us into trouble a bit more because we notice that pitta peaking again, but at least you can feel it and see that that is true. So it doesn't mean that you need to change everything about your lifestyle, but it's good, I think, once you get the framework of it, you can start to become more aware of these things. That's why I also like thinking about the seasonal stuff. You can see these things for yourself and start to notice these properties. So general things to pay attention to is when you're waking up in the morning, do you feel hungry? Is there a coat on your tongue? Those types of things might tell you maybe you're eating a bit too late. Doesn't mean you need to change your entire schedule of things, but maybe you could shift some things. In general, you really do want to avoid putting your biggest meal, though, during that kapha period, during like too late in the day, eating in the middle of the night. So the best you can do to try to shift it, to try to fit it in. That's why I think Ayurveda works well with intermittent fasting. So kind of if you looked at the timing of it, if you just stopped eating after dinner, right? Let's say you had your dinner around 6 p.m. and didn't eat until 6 a.m. the next day, right? That's automatically giving your body a 12-hour fast. And that's what that nighttime pitta fire is for, to really burn through and do the detoxing. So shifting it out, figuring out where you're going to put your fast periods in, but you want to be careful when you're doing your intermittent fast so that you're not inadvertently setting yourself up where you're putting your largest meals when your body's just not ready for it.
Got it. Yeah, it's a complicated sort of situation, and I appreciate you giving us a broad overview there. But it sounds like there's a lot of nuance that people can delve into. A couple of really good points here. We do know that clearly obesity can link to back pain. I mean, I think there's a clear link there. But I guess the point here is that it's a complicated situation where it's not just your weight that matters. You can, like you mentioned, Dr. Kumar, Arnold Schwarzenegger was technically obese, and obviously he did not have, well, I don't really know, but probably did not have any back problems. He was in very good shape. So it's also just about, postural changes and core strengthening. So, Joy brought up something here in the chat about, her neurosurgeon said that the less you weigh, the less stress there is on the spine. And I think that's probably true. I think there's this dictum of, for every pound you have in abdominal fat, you're increasing by 4 to 10 pounds of strain on the spine. I'm not sure how accurate it all is, but I think that there's some truth to that you are putting strain on your back. That's why core muscles are really, really important. And that's why not everyone who is obese has back problems, because they're also strong on the inside. But it's a good question here about how low is it smart to go, because you might see people on the opposite end of the spectrum really going too far in the direction of weight loss. And what do you do when you see people in that situation?
when we see people that so we rarely see people, adults, go too low, unless, you know, we typically don't see people with eating disorders or restrictive eating disorders or bulimia, but your body typically won't let you go too low. There's sort of a mechanism built in where we hit plateaus, because as we lose weight, our metabolism drops and these weight regulating hormones change in a way to help us maintain some minimal body fat percentage or some body mass. And a lot of that is genetically determined. So two people that go on the exact same diet are going to lose a different amount of weight over a different amount of time, and their bodies will stop them at a different place. So I would say in our practice, we rarely encounter people that lose too much weight, only because it's so hard to lose weight once someone has gained the extra. But of course, if we saw that happening, you know, we would intervene and assess for an eating disorder and assess for malnutrition if that happened.
Got it. All right, thanks. I appreciate that. Ron had a good question here too. While you're trying to lose weight, you know, and this has happened to me, I bet to a lot of people, you kind of plateau at some point, and it's hard. Sometimes we reach these phases where it's hard to keep going. I'm curious, Dr. Kumar, if you have any ideas in terms of what you do there for people. And Dr. Mulvihill, also, I wonder if there are other integrative therapies or foods or anything, or different styles that you would recommend to kind of get that fire going back to, you know, increase that metabolism. So Dr. Kumar, what do you do in those cases to try to like get that metabolism going again?
Yeah, so I would say it depends on where those plateaus are. So I think that if we start with a patient that has obesity and we hit a plateau at, you know, after they lose 5% of their total body weight, but they still have obesity with complications, that's where the staging comes in. So if they still have a blood sugar problem, a back problem, a blood pressure, cholesterol issue, I would say that we would potentially introduce medicine to help them break through the plateau. We use things related to appetite control and medicines that work on all those hormones I talked about. Sometimes it's tweaking the behavior, sometimes changing the type of exercise, introducing intermittent fasting. So sometimes changing our approach might help someone break through a plateau, but there's many things we could do, ranging from changing behavior to diet to exercise, medicine, or even surgery if somebody can't get past a certain point.
Got it. And Zach, what do you think?
Yeah, so I mean, definitely, I think in general, everyone's different. So some people are just slow and steady, easy, just to kind of come down like this. I'm not that way. I can lose weight really quickly and then I plateau, but then I can lose weight again and then I plateau and then maybe I go up again or something. So I think it's important to kind of see where we're at. You know, it's multifactorial, see what's going on and how we can change an approach. One thing I kind of want to say, we were kind of tying a little bit to the last question, like I think a lot in Ayurveda is really about like kindling Agni, which is closely related to Pitta. It's this concept of your digestive fire. So a lot of times what's going on with all these conditions, because in Ayurveda, they conceptualize excess weight or obesity as a more kapha condition, accumulation in the body. So usually what happens is at some point digestion got thrown off. You know, chronic stress, lots of antibiotics, different things happened. Digestion gets thrown off. That when that digestive fire is weak, we're producing more of this ama, this toxic substance, and more of this kapha accumulation in the body. So I think what a lot of the things that we're doing where we get you back, like this is really just the first step, like bring you back into a more natural schedule, get the meal timing in, you know, figure out where the problem areas are. But then there's other things we can do. There's herbs, there's lots of different things for stress eating, figuring out what's going on, what's the impulse. There's simple tips and tricks like in Ayurveda, if you feel to differentiate between true hunger and false hunger, like if you drink a hot glass of water and then go out for a 10-minute walk and the impulse is still there, it's probably true hunger. But I notice if you get into a little bit more of the intermittent fasting, but keeping it within a more Ayurvedic timeline, you start to get a really good and healthy appetite. You feel that fire burning. It helps you automatically make better food choices. It's not about, like, I think the restrictive mentality doesn't work, you know? It's more about like, how can I nourish my body the best? And that said, there's also other herbs and treatment protocols that are more based on detoxifying, trying to get the toxins out of the system. So I think lots of these different things can be brought in when we're kind of in a plateau or just really at any point.
That's great. I wonder, do either of you know of any, you mentioned, you know, adherence to your diet, sometimes tracking calories. In and of itself, just tracking seems to help. Are there any good apps or any resources that you like to tell patients about? Is there anything that seems to have worked for your patients? Either of you?
Go ahead, Zach.
I don't do so much like apps. Like basically the nutritionist Janet will do that a lot with them, like
okay.
tracking stuff. But it can work for some people. I definitely think food diaries and those things, those handouts are really helpful.
Yeah.
Definitely like towards getting a sense of exactly what's going on. Definitely my initial history always is exactly what you ate for breakfast, lunch, and dinner. Snacks and beverages is always part of it. So
Right.
personally, maybe later on I'll incorporate them more, but I don't use them as much.
Yeah, so we probably use them a little more. So I'm good with MyFitnessPal, Lose It. Someone wants to do Noom, Weight Watchers. I'm willing to, go with anything that works for somebody.
Excellent. Couple other questions here. I was curious. So Daniela had a question about any particular like labs or workup that you do for someone who comes into the weight loss center. Is there some baseline screening that you do? Also, I'm curious to hear about any of the, just briefly, any medications that are routinely used to aid in weight loss.
Sure. So we do like an initial screening of some blood tests, as well as a pretty significant questionnaire looking at somebody's weight and complications and mood and sleep and things like that. And then in terms of blood tests, we screen everyone for diabetes, thyroid, basic stuff there. And then in terms of medicines we prescribe, I would say that medicines are generally underutilized. Probably, I think, less than 1 or 2% of patients in the US that meet criteria for medicine for weight loss are actually on it. And there are currently 5 FDA approved medicines for chronic weight management and a few medicines approved for short-term use. So there's not a ton, but we do have medicines that we can prescribe.
Great, okay. We also just wanted to clarify what the effect of drinking hot water and when you should do it if you're trying to kind of re-spark that metabolism.
Right. So in Ayurveda, nothing cold, no cold water. So I think a lot of cultures around the world, if you look at them, they mostly drink hot beverages and hot tea throughout the day. So basically the idea there is that you have a digestive fire, your pitta, your agni, and the cold beverages will kind of put out the fire, is one way you could think of that. So in general, we want to stay really well hydrated. So kind of the approach is this: when you wake up in the morning, taking a large glass of hot water and drinking that first thing can help you to stay pretty regular. The hot water also will come in and help lubricate your colon. Usually similar to how a lot of people will drink coffee in the morning to get themselves to go. You can usually get a pretty similar effect just with the hot water. But throughout the day, we can be sipping a hot tea or a hot water will generally be nice for us. But we have to be careful about drinking too much water during our meal times. About an hour before and an hour after a meal, we don't want to drink too much water, because we're going to dilute our stomach acid and decrease the ability of the digestive enzymes to do their job. So you want to slow down like an hour or two before your meal, but then with your meal itself, you want to, between your bites, have just a sip of hot water to try to get that 50-25-25 general ratio. So that's the general approach. There are other things, since you talked about like digestion related to it. There's things like Agni teas, like fennel, coriander, different Ayurvedic herbs that you can put into a tea, and you can sip that throughout the day. Most constitutions can handle that. It actually helps kindle your digestive fire. There's other things that help increase the digestive fire, like a little one is to take fresh ginger and do fresh, like thinly slice it, some lime juice on it with some salt, and chew that before your meal. So it's all part of like this trying to kindle your digestive fire.
Yeah, that's super fascinating. So actually, it looks like our time is up. So I just wanted to call it here. This was a really interesting talk. Thank you, Dr. Kumar, Dr. Mulvihill. I think clearly the bottom line here is it's a very complicated situation. It's not all about weight loss. I think the goal is to get patients to be healthier in general. And I think the weight loss comes along with that. And with that weight loss, I think comes, decreased strain onto the back. And I think that's actually the overall goal of what we're looking for. Certainly for me at the Spine Center, that's what I'm hoping that we get out of that. So a lot of times we refer patients out to the Integrative Medicine Center or the Obesity Medicine Center. And we're hoping, maybe different ways or different approaches, but a lot of really interesting ways for people to work on this. And so I hope everyone found it really interesting as much as I did. And we'll see you next time at Spine Time. Thank you, everyone.
Thanks.
Thank
Take
you.
care. Bye.
Bye.